Welcome to Part 2 of Section 6 of the Code of Practice for Equine. In this section, we are going to cover the remainder of the husbandry practices, including identification, castration, tail alterations, hoof care, and grooming. Section 6.4 of the Code addresses identification. Identification of horses is needed for multiple reasons, including animal and public health, proof of ownership, correct identification at competitions or shows, and when buying or selling horses. There are several methods of marking horses for identification or ownership, including permanent or temporary methods and methods that are visible or non-visible. All methods of permanent identification cause some degree of pain to horses, with the exception of the iris scan. There has been limited research in methods of identification and pain, but research done on hot iron branding has shown that there is pain associated with it. It also causes a skin burn that results in swelling and skin sensitivity in that area for several days. If branding is necessary, the code requires that you do not brand horses on the jaw or cheek and never brand a horse when they are wet. Also, when registering new brands, select an approved site other than the jaw or cheek. Consult the appropriate provincial regulatory authorities, breed registry, or sport council for more information. There have been some studies comparing hot iron branding to freeze branding, and they suggest that freeze branding causes less pain and discomfort than hot iron branding, but freeze branding still causes a level of pain. When looking at microchipping, research found that if any pain occurred, it was short-lasting compared to freeze or hot iron branding. Lip tattooing is another means of identification. However, there is limited research on this. No matter which method you choose, try to select the least painful method that fits the purpose for the identification. And the code requires that it must be performed in a manner that causes the minimum of handling stress and pain, regardless of the method used. The code strongly encourages horse owners to avoid hot iron branding and rebranding of any kind. You should ensure that the method of identification is done by skilled personnel and that the horse has some previous experience with handling and restraint before the identification procedure is performed. Take the time to discuss pain control options with a veterinarian, particularly when branding. The next husbandry practice we will cover is castration. There are several reasons we castrate horses, including to make them safer to handle, easier to manage, and easier to turn out in groups. In most provinces, equine castration can only be done by a veterinarian, and the Canadian Veterinary Medical Association regards castration of horses, donkeys, and mules as a veterinary medical procedure, which should only be performed by a veterinarian using appropriate surgical, anesthetic, and analgesic techniques. Castration should only be performed by a veterinarian, as it is a surgical procedure requiring considerable skill and expertise and has a high complication rate. Some complications, including evisceration and hemorrhage, are life-threatening. The code requires that castration of donkeys, mules, and mature horses must only be performed by a veterinarian because of an even higher risk of complication. Research has shown that castration causes pain and inflammation that persists for several days. Licensed veterinarians have access to drugs to reduce pain and inflammation. They also have access to sedatives and anesthetics, which reduce the need for physical restraint and provide the optimal conditions for the procedure. Although equine castration by non-veterinarians may be exempt from certain provincial veterinary acts, this does not exclude non-veterinarians from being held accountable under animal protection laws if horses are put in distress by a non-veterinarian performing this procedure. In regards to castration, the code requires that horses with one or more retained testicle or other scrotal abnormalities, such as hernias, must only be castrated by a veterinarian. Provincial regulations that restrict castration of horses to licensed veterinarians must be followed. Where castration is not prohibited by law, castration by a person who is not a licensed veterinarian must only be performed by a skilled operator and must meet the following requirements. First, you must have a valid veterinary client-patient relationship with a licensed veterinarian who is willing to supply training on the procedure itself and pain management. They will have to prescribe the required drugs for pain control and provide interventions if needed. The scrotal area must be examined to ensure normal scrotal anatomy. If there is evidence of an abnormality, castration must only be performed by a veterinarian. The handling and restraint methods used during castration must not cause injury or unnecessary suffering. Pain control must be provided. At a minimum, this must include a local anesthetic and a non-steroidal anti-inflammatory drug. Castration must not begin until the local anesthetic has taken effect. The horse must be monitored during and after the procedure, and if any complications occur, a veterinarian must be contacted without delay. Section 6.6 focuses on tail alterations, including tail docking, tail nicking, and tail blocking. We will start with tail docking, which is the removal of part of the horse's tailbone, leaving it significantly shorter. Tail docking was originally done to prevent the tails from interfering with the harness equipment and machinery, impairing the driver's ability to control the horses and potentially causing the horses to bolt. There are some risk factors that need to be considered when considering tail docking. First, depending on the amount of tail that is removed, docking can compromise the horse's ability to swish the tail at flies and communicate with other horses or humans. Tail docking can also lead to serious health risks, such as infections. Research in other species suggests that both surgical and rubber ring methods of tail docking are painful. However, this has not been studied in horses. Any potential safety benefit of tail docking has also not been scientifically studied in horses. Tail docking for cosmetic purposes is considered unacceptable within the code and must not be performed. Refer also to provincial regulations on tail docking if applicable. Tail nicking involves cutting the horse's tail muscle to achieve an artificially high tail carriage for show purposes. Horses that have undergone this procedure wear a tail brace during their show career, and their ability to use their tail is compromised. This procedure is unacceptable and must not be performed. Tail blocking is a procedure whereby the major nerves of the tail are injected with a substance that affects the horse's ability to lift, swish, or control its tail. This procedure causes the horse to temporarily lose the use of its tail for any function and is associated with serious health risks and complications. For this reason, tail blocking also is considered unacceptable within the code. No foot, no horse. Regular hoof care is essential towards achieving overall horse health and longevity through hoof and leg soundness. Section 6.7 is dedicated to one of the most important husbandry practices in regards to horse care and welfare. Hoof care goes way beyond shoeing. It includes trimming, cleaning, nutrition, weather, condition of ground, and exercise. All equines, including donkeys and mules, need regular hoof care, no matter their discipline or work level. Hooves must be trimmed and/or shod as often as necessary to maintain hooves in functional condition. Whether shod or unshod, hooves must not be allowed to grow to excessive lengths, causing injury or discomfort to the horse. Strategies to maintain the hoof health of horses include keeping the horse's hooves free of defects through regular trimming or shoeing, keeping corrals clean, dry, and free from mud, providing adequate nutrition and regular exercise. Hooves should be cleaned out regularly, ideally on a daily basis, and before exercise or riding. Avoid extended use of hoof polishes and use hoof moisturizers or hoof hardeners as needed. Cleaning is the most basic of hoof care and is very important. Along with keeping hooves clean and free of debris, cleaning allows you to inspect the foot for any foreign materials such as rocks or nails that may cause injury and to prevent thrush. Thrush is an infection caused by bacterial and fungal yeast-type organisms. The signs of thrush include a foul odor and a black, putty-like appearance of the frog, which is located at the heel of the foot and forms a V into the center. Regular cleaning of the hoof prevents thrush from developing by aerating the exposed area. Trimming should also be part of a regular hoof maintenance program. How often a horse needs trimmed will depend on multiple factors, including, but not limited to, how fast their hooves grow, the type of ground they walk on, and their feeding program. Trimming can also be used to correct leg and hoof deviations, and is most effective when done as early as possible in the foal's life. All hoof and leg deviations worsen with neglect and excess growth. Not all equines will need shoeing. Shoes are necessary when wear exceeds growth or for correction of conformation or gait. There are also disciplines that require shoes and can be dependent on the type of ground the horse will be walking on. Horse boots are a potential alternative to shoeing, but consult your farrier for what is best for your horse's needs. In regards to hoof care, the code recommends that you ensure the farrier or other personnel are skilled and uses recognized techniques. You should always exercise due diligence, researching the qualifications and experience of farriers, asking for references, and continuing education practices. Train your horse to stand for trimming and shoeing and get them used to having their legs handled. Provide the farrier with a clean, safe, and well-lit area. Ensure the first hoof examination for foals takes place within the first month of life and regularly monitor the foal's feet for deviations. Proper trimming or shoeing, which includes trimming and resetting, should be done every 5 to 8 weeks or as may be needed for individual equines. The frequency depending on factors such as age, activity level, nutrition, and breed. And make sure to clean out hooves before riding and consult a farrier or veterinarian for advice on how to control thrush. And finally, we wrap up this section with grooming. Like hoof care, grooming is a basic husbandry practice. Along with keeping the horse clean, grooming is a good opportunity to form and maintain the bond between horse and handler, and can be calming to the horses. It is also a good opportunity to inspect horses for injuries or abnormalities. Grooming loosens dirt and mud, which can cause skin irritation and infections. If allowed to accumulate, dirt and mud can reduce the insulating effect of the hair coat in cold environments. If there is debris, such as mud or burrs, on the horse where the saddle and harness are placed, or on the tack itself, it can also cause injury and discomfort to the horse. For this reason, the code requires that horses must be free of debris where the saddle and harness are placed. The tack must also be free from debris before being placed on the horse, and burrs causing discomfort or injury must be removed without delay. You have now reached the end of this section of the Equine Code of Practice training series. Please click the button below to return to the main Equine Code of Practice training page.